Kia ora everybody, good evening. Ministers convened this evening after receiving additional information on the movements of an individual who travelled to Northland this week. Based on advice from public health officials, we have agreed to move Northland to alert level 3 from 11:59pm this evening for an initial period of 4 days until 11:59pm on Tuesday night. Cabinet will review these settings when it meets again on Monday. This measure is being taken out of an abundance of caution, given that there aren't at this point additional identified cases in Northland that we are aware of. It is also being taken, however, because the individual has not been cooperative with contact tracing efforts. We haven't been able to identify their exact movements, and we do have some information to suggest that they were not travelling alone. Our understanding at this stage is that the person was in Northland from the afternoon of the 2nd of October until the evening of the 6th of October. Based on information from the police, we believe they've travelled widely around the region, including in Whangarei, Kamo, Paihia and Kawakawa, before returning to Auckland. Initial locations of interest, the BP Connect at Wiley's, at 49 Manu Road in Woodhill, Whangarei, between 11:20pm and 12:20am on the 2nd and 3rd of October. At the Z Kensington service station on the corner of Kamo Road and Nixon Street, Whangarei, from 3:45pm to 4:45pm on the 4th of October. The other factor that we have taken into account is that vaccination rates in Northland are low compared to the national average, and without placing restrictions on movement, there is a possibility that the virus could spread quite rapidly within the community. Vaccination rates in Northland sit at 70% for first dose and 48% for second. For Māori, that rate is lower at 52% first dose and 32% fully vaccinated. Similar to our recent move to alert level 3 in the Waikato, cases spreading at alert level 2 are a risk that we cannot take. But there's also further reason why we need to really focus on vaccinations. Without high vaccination rates, we'll need to continue to use restrictions to stop the virus spreading. So I have two things to ask of Northlanders. First, if you have any cold and flu-like symptoms, please come forward and get a test as soon as possible. Testing centres are operating throughout the region, including at Kaitaia Hospital, one Samari Place in Kirikiri, the Dargaville Hospital and 20 Winga Crescent in Kamo, and Pohi Island in Whangarei. Also keep checking the Ministry of Health website, where we will update on any further locations of interest as we manage to get that information. The second request that I have is, and I can't stress this enough, is please get vaccinated. These cases do highlight the risks of COVID-19 to the unvaccinated. Anywhere in the country, we've seen the Delta outbreak jumping borders and finding unvaccinated people. I know a lot of people are happy to get vaccinated, but they're waiting, saying that they're not quite sure whether they're ready to get vaccinated yet. With low vaccination rates across the Northland region, now is the time to be vaccinated to protect your children, vulnerable people in your communities, your elders and loved ones. Information on vaccine centres on vaccine centres that will be available over the weekend is on the HealthPoint website, and you can also go to bookmyvaccine.nz to see what locations are available close to where you live. A reminder that alert level 3 means that you need to stay in your bubble and stay at home. You need to limit your movement. That's how we break the trains of transmission if any have already been spreading within the community. So please don't go and visit family, friends and neighbours. This is a virus that can spread quite quickly, and that is part of the way it spreads. We do need you to stay home, to get tested and to get vaccinated.